Welcome to the Hit Like a Girl podcast. This is HITea with Grace, where we spill the tea on HITea. I'm very excited to welcome a very special guest today, Joy Rios, who is founder and head honcho at the Hit Like a Girl podcast. And she's also the CEO of Chirpy Bird Consulting, where she serves independent medical groups and practices of all sizes, providing strategic advice and transitioning to value-based care. Thanks for joining us, Joy.
This is so much fun. I'm so glad to be here with you, Grace.
It's so fun to have you in the hot seat and to help our listeners just get to know you as who you are personally.
Yeah, I've noticed that people, like when you look at the analytics, they're like, oh, people want to know who I am. And it's interesting because so much of what I have done, I have been trying to amplify others and not really trying to put the spotlight on myself. But then I realized, oh, it's kind of important for people to understand who I am and why this matters to me.
Absolutely. And we're all super excited to get to know you even better than we already do. So tell us about the journey that brought you to the HIT space.
Yeah, it was not an obvious one. I was not somebody who dreamed about working in healthcare my whole life. It sort of came by surprise. I thought my career would go into a journalism role, and I got kind of bit by the climate change bug. When I went to study my MBA, it was a huge focus on the environment. And I think that when I realized and learned through my studies how everything was connected, that when I finally did land in a healthcare setting, I realized how everything is connected to everything, and that this was a place that I could spend my career. I thought, you know what, this is an area where there are huge challenges to overcome. It addresses everybody, doesn't matter where you live. And, that was something that called to me. I was just like, oh, I can see myself sinking my teeth into this career and being, being of service, of being, having a value to provide.
Absolutely. So tell us a little bit about Chirpy Bird. How did that begin, and what do you and your team do there?
Yeah, so basically, I guess I could kind of back up with the strategic health IT plan that was the very first one that I am aware of, came out in 2010, and it was identifying this long-term vision of where our government and healthcare insurance and Medicare was going in regards to what do we value? It was this transition to value-based care. And that was the part that I was like, I'm on board. I love this idea. This is something that I would like to work hard on. And so at that point in 2010 time is when I started to become doing my research on merit-based incentive. No, that didn't exist. It was meaningful use in the EHR incentive program. So I spent a lot of time really digging into what was the intention behind that and how can we support doctors, clinicians all around the country in aligning their efforts with what the government said that they wanted to transition to value-based care. And so that's what I spent my career doing, is basically understanding the meaningful use program to start, and eventually the merit-based incentive payment system, and literally knowing all of the details, all of the categories, the ins and outs, and how all of the puzzle pieces fit together so that I could serve as a translator or somebody, a guide of a sense, to be able to say, hey, you guys already have a busy job addressing patients. Let me help you get to where you're trying to go faster. And so breaking down okay, here's the action steps that you need in order to make this happen. And so we now have a team of people that they do the same thing, basically trained a lot of others to be able to speak that language and support doctors in their reporting of data, essentially.
Yeah. And now for all of us HIT policy nerds, do you have any tips and tricks for digesting this information and understanding the regulatory requirements? Anything you might be willing to share with us?
Yeah, I mean, so every single year there is a new final rule. And as we do this transition, and this is one of those things, a transition to value-based care is not a light switch, kind of thing. It is something that happens over a long period of time. So I have found that in reading those final rules that oftentimes are 1,200 pages long, maybe 2,400 pages long, like they're a lot to digest. The way that I tackle them is I go through and find all of the tables and indices, and basically that kind of takes out the comment and response and the thought process around why they landed on what they landed on, but it really just helps you focus on the important part. What did they actually land on? Not necessarily why or how, just like, okay, what matters? What do I need to pay attention to?
The nitty-gritty of what is required and that people need to know. Wow, yes. That is really, really interesting and so great. And in your team that you have, how long have you been working together?
Well, we started all working together for another organization, and I started there in 2015. Robin started over there, I want to say, in 2014. And a lot of our team came from the same organization, so varies, but we started working I will say we started working in 2015, but at Chirpy Bird, we all started at 2018. So wow. Nobody's left. We're a really like core team of individuals and provide excellent service. And yeah, I don't know. I love the group that we work with.
Fantastic. That's really amazing and such a testament to the great work environment that you have working together. And I'm sure you can read each other's minds at this point, your co-founder, Robin, and the rest of the team. So I'd like to move on to the podcasting side of the house. So when and why did you decide to start the Hit Like a Girl podcast?
It was similar. It started in 2018 as well. There's a little dog cameo. In 2018, we started Chirpy Bird and we started the podcast at the same time. And I have to say that it was an exercise of transforming anger into action. Hit Like a Girl is, it comes with an image, right? Like you think you're going to hit something. Of course, that's not what we're doing. It's health IT. But basically it came from a frustration and really being angry about not seeing a reflection of me or my peers or women in general, like on stage or getting credit for a lot of the work that they do. And I think that's just come from seeing the evidence of how many women that I was working with that were so smart and talented. And I just learned so much from them. And it just surprised me that I wasn't hearing from them when I would go to places like conferences. So you'd be like a whole stage of all men. So, I'm glad to say that we're not really in that same reality, but it was one of those, like, how can I stop complaining? Because I don't want to experience myself as just somebody who complains about a problem, but doesn't do something to solve it. And how can I turn my anger into action that actually does some good? And, if you don't see what it is out in the world, like, well, how about I create it instead?
Absolutely. That makes a ton of sense. And it's fantastic. Did you intend for it to turn into the community that it's morphed into now?
No, absolutely not. That kind of took a turn during the pandemic. So, it was really just like, how do we support one another in this challenging time? Because the pandemic was something that it hit everybody really hard. There's, no doubt about it. But I think that women in particular had a huge struggle in the form of, taking care of both worlds and online school, multiple kids, childcare, like so many things came into play. And I thought, we really have an opportunity here to create a community and provide support in a way that is welcoming and just like kind of easygoing, of just like not quite water cooler, but like, guess what? We're here. If you need somebody to talk to, if you need somebody to bounce ideas off of, we are a community of people who like to support one another. And instead of like competing or, like throw all of that out the window of just like, how can we be each other's, cheerleaders for success in our careers?
Absolutely. Such a great mission. Tell us about the Hit Like a Girl Road to Hymns cross-country road trip during the pandemic. What inspired this and how was it received?
Yeah, so similar to the pandemic, it was just like, I can't believe how long that happened. Like it was 2 full years of just being essentially kind of stuck at home. And I remember after I got vaccinated, getting bit by a bug, kind of, and just feeling called to like go connect with people in my, in our community. And I decided to think big about it. And I was like, I had done a practice road trip with just me and my dog. We went through 8 states, and that was fun. But then I thought, like, I learned so much on that practice road trip. It was about 3 weeks long in 2020. And I thought, this is something that I need to share and bring with others. And it was a simple thing. It was like, okay, we know it's safe to go outside. So where are places that we can connect with women in our community to maybe go on hikes? So it's still safe, and then essentially literally like walk and talk. And I feel like that whole concept of like walking and talking is natural for all of us. Like it's a lot easier and less pressure. There's no, it's storytelling, and it's just this great way to really create memories and connection. And so I made that my mission in 2021. So yeah, it was on the road to HIMSS. We became an official collaborator with the HIMSS organization, and then connected with the regional chapters, and then set up hikes with members of those organizations, and in 32 states over 3 months. And so our last stop ended up being in Vegas, where HIMSS was located that year. And we really had an opportunity to just like look eye to eye and, hear a lot of the experiences that people had over the last couple years. And so I think that really helped become like the glue of our community. I don't know, it was great. It was fantastic.
It was fantastic. I have to say, I went to the New York City one, and I met someone there who I then met up with at HIMSS, and we became really good friends. Now we have regular phone calls, and we, are on each other's social media. And not only is it a fantastic industry connection, but it's also just a wonderful friendship that's come from it. So it's an amazing thing that you guys did that.
That's the part that has been really great to listen and hear feedback around, because I hear, there's a lot of women that maybe work in a small organization and experience feeling alone, or like they're one of just a couple, but then through our community, they're able to have these like friendships and professional networking opportunities that they otherwise wouldn't have. And so, yeah, that makes my heart happy.
What is your vision for the podcasting community now? There's so much that's happened, and it's already morphing itself. And so I'm interested to hear what you're looking forward to.
I see us going to a lot more events in the future. Like one thing that we did in this last round of HIMSS was, supporting them with a DEI panel, diversity, equity, inclusion panel. That was like a highlight of my career, having, 4 women of color having a conversation on the stage at this large organization. I would love to do more of that. And also sort of hosting and facilitating events where we get to set the tone for a conference and really like help women feel welcome and included. I'd like to do more of that. And I like this idea that we're, as I was brought up in the very beginning of our conversation, is that healthcare is complicated and there's a lot of big problems. And so I feel like one of the things I talk about is I made it up. Is the puzzle a 30,000 piece puzzle? Like how many puzzle pieces are there? But like identifying each of those, what goes into the problem, how can we connect, and then take a step back and look at the big picture. And so I feel like part of the natural progression of this community has been identifying individuals, making those connections, and then finding ways that we can create impact. Like, what is it that we care about, and how do we work together to create the change that we want to see in the world? And so 2 of the areas that we are very much interested in having an impact on is maternal mortality rates, just taking care of moms in general in this country, And then also really laying the groundwork for the next generation of women leaders. And like, how can we essentially pay it forward or create a path for more young women to follow in our footsteps? And I feel like very, very drawn to trying to pay it forward. Like sometimes if you're not in a position to pay it back, we pay it forward. And so I'm basically on a mission to do that.
That is so inspiring. Well, thank you so much, Joy, for all that you do for the Hit Like a Girl podcast and community. And we're all excited to just see how this whole experience and organization flourishes in the coming years.
So am I. And thank you for being part of it. Like, it just makes me so happy how many people have gotten involved and are inspired by our mission and like just help us build and grow together. Because ultimately, again, like it's not about me, it's about us. So thank you for being part of it, Grace.
Absolutely. So where can our listeners find you online?
Well, we have our website. It's hitlikeagirlpod.com. If you listen to podcasts, we're on Spotify, we're on Apple Podcasts. We're also on the Health Podcast Network, which is a network that is dedicated to all healthcare and all types. So I would start there. You can also find us on our socials like Twitter. LinkedIn is a good one. We're on Instagram. We're trying to do more TikTok, but that's a little bit of a challenge.
That is fantastic. So before I forget, did you happen to bring any tea or coffee with you today?
I did. I brought my coffee.
Tell me about your mug.
So a friend of mine from high school, her father is a pottery teacher and also has his own like pottery studio. And he was actually one of my pottery teachers when I was in high school. And so I have had this mug for 12 years. And I bought it on a road trip when I was moving from the East Coast to the West Coast. And I got it in his pottery shop in Utah, Spring City, Utah, this small little town. And honestly, I am drinking out of this guy every single day. It just brings me so much happiness.
Well, I love that. And in many ways, I see a metaphor of this pottery and this podcasting community being kind of something that you're molding as a potter of sorts, which is kind of fun and sweet to think about it that way too.
I love it. Yeah, I see that. Thank you.
Well, thanks so much for joining us today.
Yeah, my pleasure. Thanks for having me, Grace.
And thank you guys for joining us too. Check out the Hit Like a Girl podcast and YouTube page for more great episodes like Joy, who is amazing, and by Joy today. Thanks. Cheers.
Cheers.